Hello, thank you for joining us for our webinar, Implementing the Patient Protection and Affordable Care Act. Before started, a reminder that today's webinar is pre-approved for General Recertification Credit Hour through the HR Certification Institute. To receive your certificate, you must be logged in so we can verify your attendance. The certificate with the program ID as well as access to the recorded webinar will be emailed to the email address you provide during registration early next week. I'm Tiffany Gilbert from Healthy Careers Network. Healthy Careers is part of the DICE family of correlates and more than 20 years serving the industry. We are the undeniable leader in the healthcare recruitment area. Our percent focused on the healthcare industry and exclusive association partnerships help us provide unparalleled access to healthcare job seekers across all disciplines and specialties. And recent merger with Health Callings, we're now delivering expanded access to nursing and allied health professionals. Best-in-class tools and customer service, we make it easy to find your next hire faster. And into being the leading solution for healthcare HR professionals and recruiters, we also seek to provide you with information and tools to improve your ability to do your job. So we're to be sponsoring today's webinar presented by Jan Hunter, Director of the CareerSTAT Project. Jan has extensive experience in healthcare workforce development, grassroots campaign development, and acquisition across multiple industries. Recently, she was Director of Workforce Planning and Outreach at Banner Health in Phoenix. We led a team of pro managers to work with city, state, and national governments and entities to align education strategies with emerging workforce needs. One housekeeping out before we get started. Due to the number of participants on today's call, all lines are muted for the duration of the webinar. There will be an opportunity for Jan to answer questions following the presentation. You may submit questions at any time through the chat box. They will be answered at the end of the webinar in the order they are received. Today will last about an hour, and we're glad you chose to join us. Now, without further delay, I'll turn over to Jan for today's presentation.
Tiffany, and hello everyone. Happy Friday. I hope you're having a wonderful day wherever you're at today. Appreciate that kind introduction to me, and I'm looking forward to sharing this research information with your audience as it relates to implementing the Patient Protection Affordable Care Act. I'll give you a little bit of background before we get started so you know how this research came to be, and a little bit more about CareerSTAT and the National Fund to give you some context. So start with the National Fund. The National Fund for Workforce Solutions is a part of Jobs for the Future. And if you don't know Jobs for the Future really seeks to within the educational and job infrastructure to ensure that the U.S. has a sustainable pipeline of workers in a number of different sectors, including healthcare. As a result of that work, it became very clear to the National Fund and Jobs for the Future, as well as our funder, the Joyce Foundation, there's a lot of work to be done within the healthcare arena around the workforce, particularly as the ACA rolls out. So our objectives at CareerSTAT are really to empower employers, share best practices, provide resources and coaching as you begin to develop your frontline workforce. And one of the things that we became aware of is that we needed more information about the state of that workforce and what that workforce would be required to do under the ACA. So when we talk about frontline workforce and what it means to CareerSTAT, because it may be very different than the way you look at it at your organization, is really looking at individuals who have a high degree of patient interaction that are really on that first rung of the career ladder. They're typically folks that don't have a college degree, although they may have an associate's degree, but they're not the highly educated, advanced degreed individuals. Yet we know under the Affordable Care Act, they have some key impact on the way we're going to be reimbursed and whether we're going to receive full reimbursement for Medicare. So that is so important to, and we believe, to our healthcare partners. We have 95 healthcare employers who have joined our partnership, and we interview individuals for this paper across the country. So the perspectives that we'll be talking about today include a national perspective. they may not always match exactly what's going on in your area or your region, so keep that in mind as we talk about this research. The research was begun in 2013, so about this time last year, and we interviewed a number of organizations to ask them what they saw to be the impacts of the ACA on their frontline workers and how they were going to respond to those impacts. And so all of that great information was compiled into a report, which you are more than welcome to download, or if you email me, I'll send it to you. And I think Stephanie included my email at the end of the presentation. But it is on the National Fund for Workforce Solutions website under CareerSTAT Project. However, if you have a hard time finding it, just let me know. So with that background in mind, let's go ahead and talk through this research. So let me give you some insights on where I hope we can go today. The goal of this is to really just share the research and the findings. Some additional insights that I've sort of culled along the way as I've talked to different employers about this research over the last 6 months. As you know, ACA is always evolving, and we've had an implementation plan that has sort of ebbed and flowed as various things have taken place. So it's always a work in progress. But we are gleaning some great information from our employers about what they're doing to address it. And again, I'll share those with you anecdotally today as well. We all include a little primer on the Act itself. Now, I don't know how many of you have had the opportunity to actually read all 20,000 pages, but thankfully our researcher did a lot of work in that day. And unfortunately, he was not able to be here today, but this presentation, I think, represents a lot of what he learned. Talk just a little bit about the kind of jobs we see emerging, and again, I'll share some anecdotal information as well about that. Our point of view on the role of HR and workforce planning, which is great for all of us. HR workforce planning, we are critical in helping our organizations meet the goals of the ACA. So that's really, really good job security for us. We're even more important than ever before because we do play that strategic role in making sure the workforce is there to meet the employer needs. And last but not least, we'll talk about some of the opportunities that exist, recommendations for what you can do within your organization to address some of the challenges that we're seeing. So hope that makes sense to you. And as Stephanie said, please keep your questions to the end and let ample time to answer any questions that you have. So I'm looking forward to that part of the discussion. So a little bit about the ACA and frontline workers and that impact. Frontline healthcare workforce is really being called out as even more critical than it's been, I think, in years past. And as a workforce development professional myself who had to focus on developing talent pipelines, recruiting talent pipelines, we have movement there. Let's go back. Probably one of the many folks who said, well, the frontline workforce will really take care of itself. I have limited resources that I can spend. So I'm going to have to, focus on other roles like nursing and pharmacy and physician development. And the ACA came into play. And until HCAPS came into view, I don't think these workers really got the attention that they deserved. But under ACA, there's a huge impact, not only in the way we get reimbursed, but it's just the sheer volume of work that will be needed. And I'm sorry, Stephanie, did you have a question?
I just make sure you're on the presentation overview.
Correct. Introduction. I actually moved to the introduction. Is everyone able to see that okay?
I'm still seeing the presentation overview slides. So,
great. Okay.
I'll manage the slides and just whenever you want to move forward.
Okay, go to slide 6, please. Next one. There you go. Great. Well, I did just cover this slide, so I think we can actually move. Next one. Thank you. So here's a point of view on what the ACA is going to mean to our healthcare providers. First of all, this is a huge transformation. I know as a healthcare person or recruiter, you're feeling this already. But what a lot of people don't know is this is forming 1/6 of the U.S. economy. And this is probably the biggest transformative change since Medicare and more recently since the internet. I mean, that's the sheer scope and volume of this change. It's changing the way we deliver healthcare, and it's changing the way we get paid. Completely different and turning it sort of on its ear. I worked in acute care for 11 years in level 1 trauma centers, magnet hospitals, and mental health providers. And it really, if you talk to the frontline worker, doctors, nurses, and others, you'll know that that there's been a major shift. One of the challenges about that for our current workforce is that they weren't educated to think this way. And the educational system really has not caught up with this way of thinking, the focus on wellness, the focus on coordinated care, and focus on patient-centered care. I think if you asked a provider, they'd say, well, I always focus on the patient. But the measures are very different in terms of how that is being perceived by the patient. It's very different for them. It's going to change the way and the skills, the abilities, the approaches, the mindset that we need in these individuals. So not only is the volume going to increase, the way they need to be able to be trained, their mindset, the way they approach care delivery is completely different than it's ever been before. And it's happening at a rate of change that I think is unprecedented in healthcare. You know, one of the things that I really enjoyed about healthcare after having been in high tech and in financial services is sort of stability and continuity. I mean, for the longest time, things sort of stayed very stable. Leadership was very stable, strategies were very stable, and now the rate of change is accelerated, which creates another additional challenge for our incumbent workers as well as new workers coming into the workforce. And of course, the pay for performance model is, again, transformative. It really requires different skills than our current incumbent workforce may have and was entering the workforce because, again, the educational program providers may have not caught up with these changes. Can we go ahead and move to slide, I believe it's slide 8? Thank you very much. So you may be familiar with some of the goals. Here's our perception of the key goals of ACA, and really it's going to expand the access of care. The pool of individuals who are insured will be bigger, but they'll also be very different than the current insured individuals in point of view. Through the care exchange, we're able to cover individuals who would not have been able to get coverage before. For example, 8% of the poverty line. So different individuals with different perceptions of that health care should be, not necessarily a sophisticated consumer of health care like some of the individuals who had insurance for a long period of time. We're also going to be getting maybe some sicker patients who didn't have health care, who were delaying treatment for a chronic disease or a pre-existing condition will now be entering the system, and they be sicker, or they have a number of chronic diseases that we didn't have to deal with as intensely before. So this changes, again, the skills and abilities that our workforce needs to be able to have. They need to be able to communicate with individuals who maybe do understand the healthcare system. They don't know how to do their own personal navigation. As a part of the healthcare law, it's our responsibility to ensure that they know how to navigate the system and that it's integrated. And of course, the aims of the triple aim, which is to provide the best cost resource to care for the patient at the lowest cost. So it creates a huge shift in the work each individual may be doing. For example, if you're a CNA in acute care healthcare and you move to a wellness setting, your duties, responsibilities, daily life work is going to be very different than what you've experienced. You're probably going to have to be able to work more independently than you had to in the acute care environment. If you think about that across the number of healthcare jobs that will be moving into the wellness setting, there's a opportunity and need to retrain and refocus individuals on their core job duties. Okay, so let's move to the next slide. What all happens? Well, number one mechanism is pay. So it's either you will be paid for performance good performance, or you will be, I guess, penalized is the word I'll use, for poor performance in these areas. And the expectations are very different, and outcomes are very measurable. And again, this is very different than what we've experienced before. And it does put a lot of pressure on us as healthcare providers because the world is very uncertain. We know from quarter to quarter how we're going to be rated by patients on these different mechanisms and what reimbursement's going to be. So again, when we talk about sweeping change, that's such a difference in the individual mindset of leadership within the healthcare organization. One of the challenges, I think, from a workforce perspective that this is they don't know if they have done best in workforce development. They don't feel as certain about it, and that as workforce development professionals, recruitment, HR, that means we have to be even more strong about making the case of why these investments are very important. So let's go ahead and move to the next slide. What does this mean in terms of labor? I mean, what does it all boil down to for us in our daily lives? It's clear that job growth will be moving from acute care to the outpatient settings and home health care and long-term facilities. Occupational demand in the frontline worker, but not a typical frontline worker of days gone by. As mentioned previously, the expectation is going to be very different for these individuals. So where, a CNA from any educational program might have worked in the acute care setting, now we've got to really think about the job scope in all of these different settings. And the mindset and the skill set of individuals, the softer skills, become critically more important as we begin thinking about who's the right fit, best fit for which environment. And that's our job if you're in a recruitment situation or position, even more challenging. You've got to kind of screen for soft skills and competencies, not just clinical competency and not just licensure and not just education. Now there's a whole other set of criteria that you're going to need to be thinking about based on the setting where the person will be performing the job. I think to be asking more in terms of scope of practice from each of these job classifications and asking them to perform at the top of their license and in ways that we haven't asked them to perform before. Take again that home health aide perhaps, or that CNA who in the inpatient setting, especially the CNA in an inpatient setting, might have had an entire team of folks helping them and giving them direction. If they're a wellness clinic and they're on the front line, they may have to be, self-motivated, self-directed in a way that they didn't have to be in the acute care setting. So it's transformative in the work that these individuals will be doing. And I think we'll also see, a lot of emerging roles. The nurse practitioner becomes vitally important, the health navigator, the patient coordinator, the patient navigator, whatever you call it, where you're at. The person makes sure that the patient gets from point A to point B and gets access and seamless access to the care that they need is also going to be an emerging role that I think we're going to see. Okay, up to the next slide. All right, so what does the Bureau of Labor Statistics say about employment growth by subsector? Here's a little bit of information for you to consider. You can see there is significant growth, but not necessarily sheer volumes of numbers. So, there's still going to be growth in hospitals, and so don't overlook that in your planning and your thinking. Just because we're moving to the wellness model, the hospital will still see growth. Also, a lot of churn due to retirements and just turnover in general as people want to move into these new things. So, unfortunately, we haven't made things more simple. Our need to recruit just expands. But home health care being a big part of this change. And as people begin to access the system, of course, all the ancillary services begin to have more impacts as well. So your laboratory and your ambulatory care services become more impacted. Now, for those of you who have been working on the laboratory science problem, this only exacerbates the problem that we've been seeing for the last 10 years. So new ways of automating, new ways of delivering these services, we're really going to have to think about how we're going to meet the need for all the laboratory scientists and med techs that are going to be retiring here in the next couple of years. Let's go ahead and go to the next slide. And just looking at this a different way, where will the care be delivered? As I mentioned previously, I think there's a notion that people think, oh, the hospitals are going to close because everything's going to go to the wellness model, and we'll really just have the patients with the highest acuity in the hospital. But if you look at the statistics, and from AMA actually, notice that hospital services are going to continue to grow. So not as much as all practitioners, which is physicians' offices and home health care, there still is some significant growth there. So, again, we can't forget about the other job classifications as we're focusing on frontline workers and the wellness model. Okay, let's move to the next one. And here is some information about the largest growth positions. And as you can see, these would be what we would consider to be traditional frontline workers. So the number of jobs doesn't really change, although in some cases it's filling. But if you're looking at it, it's really still a significant number of jobs. The focus for these individuals is what's really going to have to change. And the mindset of these individuals. This will not be an 8-to-5 job. This will be a job where you play a critical role in how we're being paid for our performance and our success and sustainability as an organization. So again, that investment in the frontline worker is going to be critically important. I have a feeling, and I'll just do a little bit of prediction here. My guess would be that even though a lot of these positions and a lot of these individuals don't always have a high school degree, I think we'll see the bar being raised on the amount of education required for these individuals. And I would suspect that if they're not licensed in your state presently, there will be a licensure requirement for the individuals. Other things that I hear from our employers in CareerSTAT is, especially those that are consolidating their physicians' practices and maybe acquiring new physicians' practices as they bring them on, the disparity between what a medical secretary, what a medical assistant does in their office. In some cases, they're highly educated individuals with a certificate or a degree from a trade school or even sometimes a community college certificate program to, I hired my aunt because she's a nice gal and patients like her. So again, I think back to the licensure requirement. If there's not one currently, there will be, because there will need to be standardization amongst these job classifications as they continue to grow. So let's go to the next one. So again, there's more information about some of the fastest growing occupations. You'll see, again, it's across the board in terms of the frontline worker, including now, the medical sonographer, which has been a growing, position for a long time. I'm not really sure that the ACA is impacting that in any way, other than maybe some of the X-ray tech or the educated individuals could move into a wellness clinic as we start to treat, broken bones and things, as opposed to going to the emergency room. But as you can see, all levels of the front line are increasing by a significant amount, but the biggest increase, again, in home health care and personal care aides. Okay, me. So this is just a little bit of information on what happened in Massachusetts when healthcare reform was implemented. So for those of you who are not aware of it, they sort of went forward with healthcare reform under Governor Carey before healthcare law ever came into being approved. So here's kind of a preview, maybe, of what you can think that will happen or spread across the nation. As you can see, the positions grew exponentially the first and the third, as opposed to the rest of the nation. So administrative positions became more important, and patient care support. So individuals who are helping that navigation of the patient through the system. What did a little bit, or what didn't grow as fast is other care professionals. Again, what this says to me is supportive positions grow, patient-centered positions grow, and others maybe don't follow quite as quickly. Go to the next slide. Talk a little bit about this at the top of the presentation, and I alluded to this a little bit in terms of the transformation about the entire system. This view, and this comes from research with healthcare employers across the board and across the country, where CNAs had a very defined role as a part of a patient care team in the acute care setting. They have a bigger role in these areas in the outpatient setting. So their roles were going to be expanded, and those soft skills, the communication, the critical thinking skills and observation, make sure the patient understands what's happening next, what we need to do, what the provider will do, and how it's all going to work, is going to be a part of their role, as well as taking on some of the tasks that maybe RN doesn't necessarily always need to do, that the CNA could do is at the top of their scope, with obviously some supervision, maybe some training. They can do documentation, they can do med pulls. There's no need to use a higher cost resource for those and a lot of other things. But this does require training, so it's not just something that can just happen. Same medical assistants, again, I think we're going to see them playing a much bigger role and a standardized role across systems. So whereas if you look at, 10 different employers, you'll probably find 10 different job descriptions. For the ACA, it becomes vitally important that we come up with some point of view on what a medical assistant should be able and should be licensed to do. And of course, we all know the health IT and electronic medical record becomes critically important through ACA as well. And with the advent of the ICD-10, the effect of the workforce, at least from I've heard from my employer partners and what I experienced, is we have a lot of coders out there that really are not jazzed about the ICD-10 transformation. And I think we're going to see attrition in the number of coders, because that's an older population of worker. This may be the thing that pushes them toward retirement. So a lot of work will need to be done in building that workforce, making sure that they're educated to handle the complexities of electronic healthcare record, which is more complex than it is under ICD-9. And then, I think there's also in some organizations data analytic expectations that maybe weren't there before as well. So that will need to be rethought, and roles and responsibilities, of course, will change. Okay, let's move on to next. Other roles that we haven't traditionally had, but again, I alluded to earlier in the discussion, is the role of case managers and others who communicate with these newly injured individuals and current population of patients. Although I will say that for anyone who's been in an equation, at least in the last 5 to 10 years, you probably already started to experience wellness, whether you knew it or not, and an approach and a thinking about wellness. If your company had some sort of wellness program within your organization, you were rewarded for good behavior, that group of insured individuals kind of already has been trained a little bit to understand that they get rewarded for good behavior. Now, that may translate into what they're paying for insurance, and I know that it will, but the new population of folks come into for care, and the newly insured folks aren't as experienced with wellness and aren't as experienced with that kind of thinking. So not only maybe there are some pent-up demand around care conditions that they haven't addressed, they also really don't know how to navigate the system in any real way. So this role, again, emerges, and it also has a huge impact on patient reimbursement and what we're going to be paid, because this will be a perception issue on the part of the individual who's being treated. So number of these folks, it's hard to predict, but it's important that they have some very high-level customer service skills, able to think on their feet, understand how to get things done in an organization and make it happen for the patient so that we get the biggest reimbursement that we can get. So again, we'll wait to see what happens with those individuals. Okay, let's move on to the next. Stephanie, can we go to the next slide, please?
I thought you just covered the...
There it is. Okay, there must be a delay on my side, everyone. I apologize. Okay, so great for us workforce planners and HR individuals. Our role and our ability to be strategic and to have that seat at the table that we've been hoping for or maybe have already achieved increases exponentially. Because every strategy change, the workforce implications really to be considered before that strategy moves forward. So, and we have a lot of great work that we'll be able to do around integrating all of the new ACA mandates into our talent system. So as I was mentioning, where in the past we might have said a CNA is a CNA is a CNA, now we will be looking for CNAs with different skills and abilities. So we'll be able to look at the companies that they bring to the table, and are they the right fit and best fit the CNA roles that we have available in the setting that we have them available in. And we'll be transforming the way we retain and develop our workers, because with the ACA, I mean, I don't think we're done with the transformation. We've seen the first part. And for you who wonder, you know, will this law continue to be implemented upon how presidential elections go, I don't think we're ever really going to go back. So, you know, this will be an evolving process. Now, the other thing that becomes critical for us as healthcare, HR, and workforce planners and recruiters is that we be able to really measure and meaningfully measure the business impact of the work that we do. Because, you know, with financial situation that we're in, whereas we might have been able to obtain investment in the past a lot easier, now we really need to be able to show that business impact. We need to be able to have data that monitors how do our workforce is. So we need to know what's the state of our workforce to really meet the dates of ACA, and how do we need to augment that. And we have opportunity to use our skills to really help drive strategy. Because again, the talent pipeline that we have really needs to be ready to meet the strategic goals of our organization. Okay, ready for the next slide? Great opportunities come our way. With all of the challenges, we get opportunity. And I think, you know, this is a really, really exciting time to be in healthcare, even with all of the transformative changes and challenges. An opportunity to sort of shape the way health will be delivered in the future. And there's lots of opportunity for workers because of the sheer number of workers that will be needed. So, again, an exciting time as we begin to move into career-led opportunities for, you know, youth and underemployed and others. We need to make sure that we're ready to address their needs for training and development and deliver patient care. Okay, next slide. So some challenges, and I know you all are facing these, and I mentioned it a little bit around the CNA and medical assistant. There's no split. I think I asked over 25 companies, what changes have you made to your job descriptions? And everyone was sort of in a wait-and-see mode. There may have been some progress around that, and I know regionally there has been some projects or progress within collaborative work that is happening in different regions. So now, you really can't, there's no resource that says, here's a standard job description of an individual that will help us meet the mandates of ACA. So that's all sort of a work in progress. The pay model has really lagged behind delivery, and that gives us the financial challenges that I'm sure you're all enjoying and experiencing. In certain states, there are many scope of practice restrictions. So, for example, I came from California. We were to implement the medical lab tech, which is a 2-year degree. Their scope of practice was really limited in such a way that it didn't help solve the worker shortages. And a lot of those things are really out of our control as workforce development people on a day-to-day basis, although we can influence it legislatively by working together in a collaborative situation. I think we're also, embroiled in making the changes within our organization. Some of the collaborative work that we've seen in the past has sort of fallen off. So one of the opportunities, I will say it's a challenge, not an opportunity, is to work within the collaborative system, within your community, share common information about what you're doing as it relates to skills and emerging skill needs. Work together to solve those workforce shortages and those challenges. And the great news is there's lots of funding available. I don't know if you're aware that the Workforce Investment Act is up for reauthorization, and there are many opportunities to influence how that legislation and that funding takes shape. So instead of calling this a challenge, I'll call it an opportunity, and I would encourage you to really work on those issues if you have the capacity. Last but not least, some of the other challenges that I think we can address together is working in a collaborative fashion for training. So coming together, creating collaboratives, creating those training programs as healthcare providers who have maybe a spirit of cooperation instead of to do it individually and alone. So we all kind of band together. That helps create a better pipeline. So recommendations to employers and others, and this is a policy statement that we've made. We really believe at CareerSTAT that every organization should have some type of workforce planning and analysis function so that you know the skills, abilities, education available in your current workforce, and you can develop some understanding of what you'll be needing as you go forward. We recommend that you try to map your workforce skills, as I just mentioned. That strongly believes in working together collaborative to share information across the spectrum of individuals who are involved in the healthcare workforce development. So policymakers, as they start to work on the WIA reauthorization, which I believe is kind of going to the floor, or the last I heard, soon. So make sure you read that legislation and understand the changes that they're being made. I think it's incumbent upon us to also work with educators, to ensure that they understand exactly what we need in this emerging healthcare model that we're facing, because it's very different than the way individuals have been taught previously. And working together to share job descriptions, standards, definition, and work so that we don't have to all do it individually, but also let our policymakers know what works, what doesn't work. Let us know what works and doesn't work, and let others interested in healthcare workforce development know the same thing. Okay, let's move on to the next slide. So I have many policymakers on the phone today, but I did want to share with you a little bit about when we work with policymakers, what our recommendations are to them. And one of the things that we always recommend is that they create an infrastructure that supports healthcare employers. Mainly because they've given us the ACA and told us what mandates are. Our point of view policy-wise is that they support us in running our workforces and creating a workforce that can meet those mandates. We absolutely recommend that they advocate that the Workforce Investment Act really be aligned to the mandates of ACA. So if you look at the legislation currently, incumbent worker training does not get the same dollar financing that displaced workers would receive or youth may receive. And so we always advocate that employers receive just as much support in their incumbent worker training as they would in developing a new pipeline. And they also ask that they continually look at the legislation and make sure that what is being mandated really works in the real world, and that they continue to monitor that and make adjustments as needed. Next slide, please. Sort of the same policy approach here. I just wanted to share this with you folks because we do a lot of work around philanthropy. So we work with probably 25 different funders presently, from Hitachi to Joyce to Chase to Career Pathways. These are things that we them we ask them respectfully to fund on behalf of our healthcare employers and partners. And again, this is in progress. They're not as versed within the healthcare industry as you are, and they're not as aware of the challenges that you face. So opportunities that you might have to meet with them and talk to them about your individual needs would be great. And obviously, always call on CareerSTAT if we can help you for those meetings. We're happy to do that. Let's move to
before we move into Q&A, please take a moment to note the program ID number for today's webinar, 20879. You need to reference this number when you apply for your recertification credit. This number will also appear on the certificate of completion you will receive next week. Now let's get to the questions. So Dan, earlier talking about how to measure business impact. Are there metrics that you're looking at first as they're making these changes for ACA, or you recommend start us for measuring what they need to deliver for the changes?
That's a good question, and I will say among our partners, that is probably the most challenging question that they face. And so the answer would maybe be 2 or 3-fold. And I hate to say it depends, because don't you hate that? But it kind of depends on that in making the changes. What I like to recommend that before you embark on a change, that you try to measure in advance what net present value of that change would mean. Now, this is a concept, it's a finance concept. If you haven't used it before, I'm sure you have finance folks or operations folks within your organization who can support you. But basically what it says is it looks at the cost of the total project and business impact, either cost savings or cost increases. In HR, that translates into, things like, if I put an encumbered worker training program to develop my ICD-9 coders to be able to do ICD-10, what cost, what reduction in recruitment costs because we've developed our own versus recruited externally. We look at, will there be a reduction in turnover and costs associated with that? And some other things to track like engagement scores and the business impact of better engagement. But those would be the kinds of things would look at. In mid-project, let's say you've already implemented a program, you would want to look at the success rate of the individuals in the program. So things I might look at would be into the program. So did they complete the program? Then once they completed the program, were they absorbed into the organization? And the result, what was the cost savings from not having to recruit externally on board an individual? You might try to look at things like productivity because, they already know the organization, so hitting the ground running in a role should be easier than somebody coming in from the outside. So you can quantify all those things. And not to go on too long, but we do have a business impact study that will be coming out in August, and it is with Boston Children's Hospital, measuring some of these things. We'll be running that at the ASHRA conference in Chicago in September, but the publication will be available. So if you send your email or you join CareerSTAT, you'll get the publication automatically, and hopefully that will help. So I hope that's your question, and I didn't go on too long.
Sounds good. So any questions come in from our attendees, but one more question for slide 17.
Okay.
You had the roles that you have shown here. Do you any of these maybe having the biggest impact in an organization as we're moving to a wellness model, or opportunities where, let's say, a case manager needs responsibilities align well with somebody who's maybe currently an RN or are in the healthcare industry, but would be a good transition to one of these roles?
I think to your point about trends, from again being on the provider side, and you want to look at your individual demographic makeup, but typically I see that the RN population is sort of on there's two sets. There's a really new grad nurse, and then there's the older workforce. And I think that's an outcome of the nursing shortage and surplus over time. So some of the RNs who have been around at the bedside for a while and they've been in their career for some time, start to sort of get burned out, especially if it's a high acuity unit. So they're often looking for opportunities, and they'd make a great, health coach, case manager due to all of that experience. So that would be one way I would look at it. I think that, in the new grad nurse, it would be good just to kind of get experience belt and then move into that role.
Okay. We just have one come in from Anne. Their students are studying in medical assisting and medical billing and coding office administration. What can we do for our students to support the ACA mandate? Information that we can extract to align our curriculum currently?
Great question, Anne. I've seen some revisions in curriculum. I don't know where you're located, but one of the organizations that has a great model is CUNY, C-U-N-Y. It's an education, it's a bridge, and I'll be happy to send you information on how to connect with them. But they mapped out a really cool program and a really great career lattice for individuals entering that profession. I think there are incumbent workers. What I would suggest is that you invest in their understanding of ACA, really understand what it means. Because I know when I've talked to employees in my previous roles, they really think it's insurance reform. They have depth of all of the different elements. I don't think we've been great about communicating it because it is so complex and such a moving target. But I think more that you can reinforce for them what their day behavior and interaction is with patients and how that really affects the organization, the more that you can keep them that of mind for them, the better performing they will be. And praise them when they do well. There's a lot of data now that's very transparent that we didn't have before. So it's a great opportunity to show them, okay, this period of time, think about what, your patient interaction, and here's the outcome. Because they don't know how they're perceived. Helps you, Anne.
And she's from Massachusetts, so if there's anything else you want to add based on location?
I don't know if you're connected at all with Bach, or not Bach, wouldn't be Bach. I can connect you to some of the workforce work that's being in Massachusetts, quite a bit in Boston, maybe some models that have been developed. And again, if you want to go through Stephanie to connect, I'm glad to connect you into that work.
Yep. I'll maybe both get connected after the webinar.
Sounds good. I'm looking forward to it.
For any patient navigator job descriptions that are currently utilized by other organizations that you would recommend?
Not to come to top of mind. Cutting-edge organizations within our partnership that I might have you just think about connecting with. Johns Hopkins, Cleveland Clinic is always ahead of the curve. Norton Louisville has really impressed us in terms of the forward thinking that they're approaching workforce investment. So those three would be good people to talk to. And the others are just the ones that are coming to top of mind.
Wonderful. Then from Giovanna, how ACA affect or impact a pathology laboratory?
Wow. The impacts will probably be in the cost for service. So what we're seeing, and this is probably information that's gone on for a while, maybe due to the lack of workforce ability, and I know that's different in different regions, but delivering that result in the least cost-effective way is the objective. So that may mean automation, line, or some of the services, and that may mean introduction of new job classifications and pushing that scope of practice. Kind of, just like every other position, if you're a lab assistant, can more than you're currently doing and at a better cost than maybe the pathologist, and the licensure and legislative issues around that scope. So that's a great question. I can tell you in California, the automated line, the reference lab, because of all legislative restrictions around scope of practice, that is what the employers there are moving toward, and actually not moving toward, they've moved in that direction and just automating anything that they could. I think Mir and Kaiser are probably really good examples of that. Quest, another good example.
Okay. And Karen, if ACA is being taught in business schools across the country, it seems like there may be career opportunities here in the struggling economy.
Oh, it's a great question. I don't know. It should be, and I'm hoping it's in every, healthcare masters, healthcare administration masters out there, because it really should be. Now, what the curriculum has caught up with the legislation is the question. Education moves a little bit slower, and they take concerted time in adopting things into their curriculum. But yeah, I agree. I think there's a lot of opportunity, and for people who can do Six Sigma, opportunity.
Can you talk about the most important specific changes that a physician office setting must prepare for first?
Wow, that's a great question. It sort of depends on the physician's office, and the spectrum between sort of the smaller provider and the larger integrated physician practices and operations, like, for example, Kaiser has. Again, for me, and maybe selfishly or because of my role, I always believe that worker investment in the workforce and understanding the requirements of ACA is like the best investment they can make. Obviously, you want investment in technology, and you want to be as integrated as possible. Unless your employees understand what that means, you can't really accomplish what needs to be accomplished.
And the last question, unless something else comes in this minute or so.
Well, thank you very much, everyone.
We close out. The webinar will be available next week, and will include a certificate of completion, a link to access the deck, and also the recording if you would like to share it with anybody in your office or review it again. And if you're interested in contacting Jan directly with additional questions, contact information is hunter@jff.org. Interested in learning more about healthy careers and our full suite of healthcare sourcing solutions, you can contact us at info@healthycareers.com. And it does look like we just had one more question come in, so we can address that. Since we have a few more minutes, but for Michelle, can you share the need for social worker case managers versus RN case managers?
Michelle, that's a great question. I don't know that I have a solid answer other than a philosophical answer, which is, part of the thing with ACA that is really great is that mental health is more integrated into the thought process about how we address patient needs. And so I think somebody with a social worker background probably has a little more training in that area than be an RN case manager, but it would sort of depend upon the individual and what their educational experience is. But mental health and personal well-being, depression around disease and chronic illness is really important in this new model. So that's sort of the way I see it.
Looks like that is the last question. Michelle said thank you, so I think you got that covered well. So that'll conclude our webinar. So thank you everyone for attending. Have a great weekend. And if there's any questions, I think Jan and I will stay in at least for the next minute. But thanks again for joining us.